name is Cory Schaffhausen. I am a health services researcher. My institution is the Hennepin Healthcare Research Institute in Minneapolis, and I'll be reviewing a talk for Mapping the Transplant Journey, a Family Guide. For the overview of the talk, I'll give a brief summary of the Scientific Registry of Transplant Recipients, or the SRTR, and how that work has led to the development of what we call the subway map of the transplant system. And the remaining portion of the talk, I'll be doing a website demo of different resources that are currently available on the SRTR website that may be useful to patients and families. And we can walk through those, and following the talk, there will be time for Q&A, and we can discuss any additional questions. I want to start with a very high-level summary of how the SRTR fits into the transplant system, because a lot of the information that will be shared has been created through the SRTR contract. And the SRTR is one group that is funded through federal government contracts by HRSA, the other one being the OPTN. Both groups collaborate as part of the transplant system. At a very simple, overly simple summary, the SRTR is primarily focused on data and analyzing data, and the OPTN is primarily focused on developing and updating policy. So I do have a role within the SRTR contract. So the work that is presented in this talk does include work that I have contributed to the SRTR. However, for this talk, I am making my thoughts available as a researcher. So I want to share the disclaimer that I am not presenting as a representative of the federal government. The SRTR includes a wide range of data that captures many of the phases along the transplant patient journey. And so in order to help understand what types of data are available, we created this type of a figure that describes the patient journey in different steps along the way, so that we can start to literally map where data is collected at different time points, and also where a patient who is progressing along the journey might be looking for data, and what data might be useful for patients who are at different points along the journey. So this is the starting point for the process that SRTR followed to create this map. This approach to describing both the data and the experiences and different stakeholders. And this was really focused just on the patient and the steps that would be followed along that journey. Naturally, the system as a whole is very complex, and there are many additional parties involved. And so we progress from this representation of the patient journey into a more comprehensive view of the transplant system. And that image is here. And this is meant to capture at a much higher level or more complete level the different organizations or the different milestones that are all part of both the patient and the professional activities that would progress from a patient who has organ failure all the way through receiving a transplant and recovery and long-term care after. So as you can see in this image, in addition to displaying the patient who is still sort of in the center, really to literally make this transplant system depicted as a patient-centered process, the additional stakeholders or parties include the transplant centers, physicians, hospitals that are involved in recovering donor organs, living donors, regulators. So there's a wide range of different stakeholders who all work together, coordinate, interact, And some work closely during some parts and they diverge and are more independent for other parts. And we hope that sort of as a high level or sort of simplified version of the map, that some of those relationships are shown here. This graphic has now been shared with different transplant centers, different patient advocacy groups. It is widely available. It's provided on the SRTR website. We'll have a minute towards the end of the talk to see where that is located. So we certainly encourage anyone to use this, to share this with others. It has been promoted in other advocacy groups. This page here is a screenshot from the American Society of Transplant Surgeons, who are promoting this as a patient resource. So, we are very pleased that it's been a valuable resource, and we are definitely hoping that it can continue to be useful to patients. And so this is the image that was originally created through SRTR work. And because there's now more, wide recognition of this style of map that can be used to represent the transplant system, our group at Hennepin Healthcare has been approached by patients and transplant centers and advocacy groups with an interest in adapting this type of map to other situations. And so the next view is an example of work that has directly been the result of a collaboration with transplant families to modify the existing SRTR transplant system map into one that is specific to pediatric patients. And as with some of the other collaborations that have resulted from this transplant system map work, some of these maps may eventually be provided on the SRTR website. Currently, this pediatric transplant system map is not available on the SRTR website. We can provide this directly to transplant families or upon request, if anyone reaches out to myself or colleagues at Hennepin Healthcare. So for the initial version of this map, it is provided as the Hennepin Healthcare resource, but it is adapted from the SRTR version. So the noteworthy differences here would be to really highlight how pediatric recipients may transition to care at a new transplant center as an adult. And so that is depicted in the area that's now shown with the blue box. So this is really the key difference between the sort of standard transplant system map and our new version that is tailored to pediatric patients. We're also always open to hearing feedback, and many of these system maps have been revised and iterated over time. So if there are opportunities to better represent the transplant system or to make any other changes or clarifications, we are certainly hoping that we can receive that feedback and engage with patients and families to make the resources even better. The rest of the discussion will be focused on a website demo where I'll have a chance to walk through a number of resources that are currently available to patients on the SRTR website. So I will switch over to a screen share of that webpage. The webpage on the screen is the SRTR website. We are currently in a transition period where the SRTR website is launching this new patient-centered version. It will likely be available at the time of the conference, and it will be an update compared to the srtr.org website that is available through the early months of 2026. So the URL that is shown on the screen here may be different in the coming months as of March or April of 2026. The website has sections that are specifically tailored both towards patients, care partners, and donors, and also sections that are specifically tailored for transplant professionals. There are a number of ways to navigate through the site. One would be using the navigation menu on the far left, or using the different landing pages that are accessed through the buttons on the main page. So from the orange button here for the transplant journey, the page would then open into a landing page that is specifically designed to provide more patient-centered information. And we'll have a chance to walk through some of the key components of this page during the demo. In order to get an initial orientation of what information is available on the site, one option would be to access the menu for getting started. And there is a page that is labeled Learn About What You Can Find. And clicking into that page opens a getting started or a summary review of all of the main portions of the site. And the key focus for this page is to summarize the content and also to describe if that content is primarily designed for patients, or if it's designed for healthcare professionals, or if it's designed for the option of shared use for patients and professionals together. So as you can see, the top items on the list here are described as primarily being designed for patients and families. Towards the middle of the page, there are additional examples for resources that are designed to be shared use. And towards the bottom, there are a number of pages. These are often data reports that might be more technical, and these are described as being primarily for transplant professionals. And each of these can be used to directly access the different sections and would be an additional opportunity to learn more about the different content in addition to the menu. One of the most common uses for the SRTR website is to navigate to the tool to find and compare transplant programs. So I'll review that briefly next. The default selection for the tool to find transplant programs is typically the set to adult recipients. So if the user is interested in reviewing centers that are transplanting pediatric recipients, then this selection can be changed to pediatric. The organ type can be used to select the single organ or some of the common multi-organ combinations. For this demo, I can start with kidney. The city, state, or zip code is optional. This can be entered, or if it is omitted, the search will output a national search rather than a local search. The type of data that is presented on the search results page is somewhat dependent on the organ type. For organ types that include deceased donors and also living donors, both of those will be shown separately, as shown here on this page with the middle two columns. As you can see, some centers may have 0 living donors. Some centers may have a majority that are living donors. So that is one piece of information that can be used to inform decisions. The patient outcomes that are shown in the right-hand columns are calculated by SRTR. These are metrics that are meant to be more of a simplified or patient-friendly display of metrics that show a outcome on a range of 1 to 5. And these are depicting if the number of bars or number of tiers is low, that would be a center that is performing worse than other centers nationally. And if there are more bars, that is a center that is performing better than other centers nationally. The specific metrics that are included are somewhat dependent on the organ type. For kidney, as you can see, there is one metric for getting a deceased donor transplant faster and one metric for 1 year kidney survival. If you were looking at a different organ type, such as heart, and we update the results for heart transplant, you can see the information presented is now different to be appropriate for each organ type. Now there is one additional metric, which is survival on the wait list. And you can see also that for organ types that do not have living donor options, the metrics only provide deceased donor transplant information. The page that's provided at the initial search results is a summary. Each transplant center also has a full report that is available upon clicking the full report button. There's a number of additional data reports here, including waitlist summaries, including data on the time to transplant, and a number of additional ways to review demographics of waitlist candidates or demographics of transplant recipients. The amount of information is quite large, and so this is something that is available if it's useful, and we're happy to, or SRTR is happy to answer questions to help navigate some of these reports. An additional function or an additional opportunity to compare transplant centers is also available using the checkboxes on the far left. So as an example, if you were to check 2 or more of these checkboxes, click the compare button. The site now provides a side-by-side comparison with more details to compare different data points or outcomes. The default may be shown here as it's shown here for adult data, but pediatric data is also available. Waiting list data is available, as are some of these other sections, including the time to transplant. For waiting list characteristics, as an example that may be useful for some individuals, the age of candidates and recipients is listed using the time ranges that are shown here on the left. As an example, the range of less than 2 years old, 2 to 11 years, or 12 to 17 years. And some centers may have more or less experience providing transplants to different age groups, and that data is available if that is of interest. The bottom of the page provides a map view to help orient where different transplant centers are located. And the search radius can also be adjusted to other values, including 500 or 750 miles, which may be of use given that there are now potentially more opportunities to seek care out of state. So now the search results can be increased to provide a wider range of options. So that is currently the search result or transplant center search results and the tool to compare transplant centers. The next section on the website that we can review during the demo is the interactive transplant center map, and a section that includes printable versions of the maps that we described in our initial introduction. From the site menu, there is a section under the Patients and Care Partners heading. Here it is the Transplant System Map subheading. There's a link to the interactive system map and also the printable system map. For simplicity, I can start with the printable system map page. This page provides downloadable PDF files of a number of different versions of the transplant system map. As mentioned earlier, The pediatric specific map is currently not available on this page, but it will be provided directly to transplant families. We have also created an interactive system map, and this is now reoriented into a vertical orientation so that it fits on a web page a little more easily. And it is interactive so that we can provide information that's tailored to each organ type. And we can also customize the map to show different portions or hide portions that are not relevant. So in this case, if we were to select heart transplants, the map would, as an example, gray out the line for living donors, as that would not be applicable. In addition to the default changes to this system map, this dropdown also allows choosing different portions of the map to stay visible or to be grayed out. As an example, all patients or all transplant professional portions in the map. So this may be useful to help focus in on the areas that are most interest in the situation. And once these selections have been made, the map can be used to help navigate to additional information. And to do that, each of these stops along the way is a button, and clicking the button will open a pop-up window that has a list of questions that are relevant to that time point. And clicking on the question will open an answer to that question. And the information in the answer is all organ specific. So if the system map has been tailored to heart transplant, the questions and answers will provide information specific to heart. And as the organ type is changed, the content of the questions and answers will also change. The information that's listed under each question may provide some general background or general education, and often also includes links to outside patient advocacy groups or other organizations that may provide more detailed information that answers those questions. So we hope that this is a page that sort of provides a one-stop, platform to access information both for SRTR and also for other organizations that are providing, trusted patient information. The other stops will have a similar format, but they will provide information about different questions. So as an example, as the journey advances towards long-term survival, the questions will be tailored to that portion or that point in time. So the format will stay the same and the questions will be modified to be relevant to that point in time. Similarly, along each of these points, if there are links to outside patient advocacy groups or other resources, we include those in the answer. There is an additional section that you can find under the organ transplant journey, and I will click one of these examples here, considering a transplant. These pages we are calling the transplant journey pages. As you can see, they are also providing information for each organ type. And there's a section that describes the different steps that are involved for each of those main phases along the patient journey. And at the bottom of the page, there is a section of questions. And these questions are identical to the questions that are provided in the interactive map, but these are provided more as a text format. So depending on the device that might be used or depending on preferences, this is a page that provides equivalent information, but it is easier for search engines to find this information and share this as a result on internet searches, and it may also be preferred depending on patient preferences. The next resource that we can review on the demo is a set of online videos and infographics. The online videos can be found under the Getting Started and the subheading Tutorial Videos. There's a range of options that are available. Some of these videos are online, similar online demos to this discussion that describe in more detail some of the patient and professional content on the SRTR site. There are additional videos that are animated summaries of the transplant process as sort of a general education. And the understanding the data section would be typically more advanced reviews of SRTR reports that are often intended for professional audiences, but are available for anyone who might be interested. The section for infographics would be listed under Patient and Care Partners heading at the bottom here, visual reports designed for you. The infographics are often updated annually for different organ types and also for pediatric transplants. The most recent infographic for pediatric transplants is using data from 2024 to 2025. It is shown here. Clicking on any of these thumbnails will open up the complete infographic. This would be the example mentioned from 2024. These are downloadable as well. And additional organ-specific infographics are available for recent years listed here. So with that, I'll return to slides. So I appreciate the opportunity to review these materials, and I would be happy to take additional questions. Thank you. Well, I want to thank everyone for submitting these really excellent questions. I listed a few here that I can answer online, and if there's additional time, feel free to continue entering some. For the first question, what is one thing you wish more families understood about how transplant decisions are actually made? I guess I will answer this somewhat based on just information I hear, comments I hear. So this is potentially sort of a secondhand response, but it's, I think, interesting how commonly or how frequently I hear discussions that referring providers, and this may be organ specific, but how common it is that providers who are outside of a transplant system but might be treating patients who have organ failure are not that familiar with the specifics of organ transplant. And so I think that's one thing to keep in mind, especially for that referral portion of the journey, that unfortunately it might be particularly important to stay informed and maybe help guide some of these discussions and make sure that if you are feeling like you're interacting with a professional who may not be as familiar with organ transplant, that you're keeping that in mind and maybe supplementing that with information from other sources. So excellent question. A second question here, since kids have a lot less transplants than adults, is the data as accurate for pediatric centers? Do centers with adult and pediatric transplant do better? So This is definitely something that is accounted for, in particular with some of the reports that were shown on that website demo for the SRTR information about centers. It is true that in some organ types where the pediatric rates are particularly low, some centers may not have the same level of information available. So in some cases, instead of having an icon that lists if the outcome, how the outcomes compare, it might just be blank, and it might say it's basically not available. And the reason is maybe the numbers are too low, and so that's just not provided as a way to avoid um, sort of implying something about outcomes based on information that's not sufficient. Um, I will add that the methods that are used by SRTR to compare different outcomes at centers do account for the sample size. And so that I think is helpful to know because a center that um, is uh, uh, shown as like a very high performing or very good outcomes, if they have a smaller volume of transplants, uh, that is accounted for. And so it just what that technically means is that um, the the outcomes may actually be slightly better at a transplant center with smaller volume in order to uh, be as confident if the sample size is smaller. So the short answer is it is accounted for. So if you are seeing a listing on the SRTR site for a pediatric center or a center that has lower volume, and it does say that the outcomes are, typical or better, that you should have confidence in that. The sample size is part of that calculation. For the second part, do centers with adult and pediatric transplant do better? Um, I don't know if there's much evidence that it's anything that's a broad, generalizable um, trend. I think it's probably best just to consider that case by case, and if there's a center that fits other needs, and you can see from different sources of data that the outcomes are what you are looking for, I would base decisions on that. And next question here. How should providers recommend their patients use the SRTR website and information? Um, well, I guess we're hopeful that there's information available for um, different levels of familiarity with transplant. So the demo provided some examples. There's pages that are more introductory, the pages for the transplant journey or the system map where you can kind of zoom into different questions. Hopefully, those are pages that can provide a little bit of an overview of different steps and different things to think about. So hopefully that's a site that providers would feel comfortable providing to patients, just if they're interested in reviewing that. There's a section called Decision Tools within the main menu. You can find it there, and there are a number of tools, and we are hoping that some of these tools are good opportunities for patients and providers to have a discussion. So, in particular, if there's a tool that provides an estimated survival or an estimated outcome, waiting time, or the number of candidates who are on the waiting list versus who get a transplant over a certain period of time. Those are things that might really be useful to talk with patients and providers together to think about if there might be any strategies that could be considered to decrease waiting time, increase options, There are a number, I won't go into details here, but I think that providers would probably be able to provide some tailored information if those are things that are of interest. And I would say there are some patients, maybe including viewers here on the webinar, who are very savvy and would be comfortable getting into some of the tools that are originally designed for professionals but are available to anyone. And so those might include some more detailed reports, and those are available if it's of interest. So I guess hopefully the path could be to start with some of the introductory materials. If there's interest, if there's opportunities to have discussions together, some of those decision tools would be a good place to start. And if there's interest, there's sort of an endless variety of other pieces of information if that's of interest.
Dr. Schaffhausen, this is Joseph Hillenberg. For everybody else, I'm Joseph Hillenberg. I'm a parent of a 14-year-old heart recipient, and I've have had the privilege of interacting with Dr. Schaffhausen and the SRTR on a number of occasions. I wanted to really thank the SRTR for and its contractor for Hennepin Healthcare Research Institute for being very responsive to the pediatric community here. 3.5 or more year, almost 4 years ago, SRTR held an in-person conference to garner public opinion and input, and a number of parents and pediatric providers went up to the podium or the mic and basically spoke out about the need to encourage the SRTR to think in terms of longer term outcomes, not just 1 year, because we parents and pediatric providers don't think of it in those terms. And so I think what Dr. Schaffhausen has demonstrated here today is really the fruit of that, building upon their substantial previous effort with the subway map and the rest of the website to illustrate that we're looking beyond just the 1 year and going to 10, 20, 30, 40 years and beyond. So I really appreciate the responsiveness to the community, the pediatric community there. So really making it easier for us as parents to think in that capacity. I think that's very helpful. So I appreciate it.
Certainly. Yeah, absolutely. Yeah. And I mentioned this in a question that was answered on the chat section, but just to reiterate, people didn't see that, under the section for decision tools, there is now, it's actually very new, there's now a tool called long-term outcomes. It includes information for kidney, liver, heart, and lung. And it's one of the tools, which is not the norm, but it's one of the tools that does have data for all ages. So it include, you can select an age from age 1 to 99 or something, maybe 90. And it will provide an estimated survival based on existing data up to 15 years. So yeah, I encourage everyone to check that out. And I agree that part of the motivation for that was hearing some of this feedback, during the conference and in other settings.
Thank you, Dr. Schaffhausen. I don't think we have any further questions. So with that said, feel free, everybody, to stay for the rest of our sessions throughout the day. And thank you, Dr. Schaffhausen, again.
Thank you. My pleasure.